say, use the chat button to make any comments or questions. Ensure you're in good sitting position and be aware of your environment. And stay safe. You can proceed. Thank you very much.
Okay, thank you so much, Destiny. Next, we'll be moving to our opening remark, and it will be taken by our SPE Fupri Chapter Vice President, the person of Ifoma Lucy. Over to you, Ifoma. 3 minutes, please.
Okay, thank you. I want to welcome everyone to this special occasion. I want to welcome our keynote speaker, Mrs. Paul Otite Douglas. I hope I got the correct pronunciation. I want to welcome our speaker, Dr. Onye Obasi. I want to welcome all the members of the Nigerian Girl in STEM present. I want to welcome all the members of SPE Fupri Chapter present and other SPE members. And I also want to welcome the members of the Warri Section 104 Diversion and Inclusion. This program is to mark the International Day for Cervical Cancer Elimination, which is today, and Breast Cancer Awareness Month was last month. So we had to come up with this program to create an awareness. So I encourage everyone to please listen, ask questions when necessary, and try to learn 1 or 2 things from today's program. Thank you very much. Over to you, moderator.
Thank you so much. Thank you so much, Ifoma. So we'll be moving to our keynote speech, and our keynote speech will be given to us by Mrs. Umfom Otite Douglas. She will be giving us the keynote speech for the program this evening.
Yes, good evening, everybody. Can you hear me, please? Can you confirm you can hear me?
We can hear you, ma.
Hear you, ma'am.
Okay, please. Thank you. Now, basically, the D&I committee was launched in 2020 and was previously known as Women in Energy, which was originally established in 2019. The vision for D&I is to advance the society's commitment to diversity and inclusion within the oil and gas community through collaborations and education. Now, this program today has to do with breast and cervical cancer prevention, and we have a doctor in the house who is going to talk so much about it. But I'm sure a lot of us, or if at all any of us, are aware that I am a survivor of breast cancer. And that's since I was diagnosed 2020. And to the grace and glory of God, I'm still kicking strong. So when we talk about cancer, what is cancer? Is basically a group of cells growing abnormally in your body. Okay, so when you have them, we have the cells grow daily, but when you have this abnormal growth taking place and then causing the disease, then we have with cancer, the growth might be cancerous. Now for breast and cervical cancer, the basic prevention for cervical cancer has to do with being vaccinated, but vaccination is not for everyone. You should be a virgin, and that's why usually it's looked at for children within the age bracket of 9 and 14, thereabout. So the vaccination is against the human papilloma virus. That's what that vaccine taking it about. And then another prevention method for cervical cancer is regular screening, what is termed pap smear. This will detect precancerous cells, that you have cells in your body that's in your cervix now that may eventually become cancerous. With the pap smear, okay, that can be detected early. The key thing in cancer is basically early detection. Early detection is the key thing. Another prevention method for cervical cancer is safe sexual practices. You should use condoms and limit the number of sexual partners. Not because for ladies we're looking for money. So just anybody that promises us 10 naira, we jump into bed with him. It has an adverse effect on our cervix. Then, of course, healthy diet and lifestyle is also an important prevention aspect. In the case of breast cancer, regular screening also, like I said, that is the key for any cancer. Regular screenings. For breast cancer, you do what is termed a mammogram. Mammogram is just like doing an X-ray of the breast. Like that's using a layman's language. So your breast is going to be examined for abnormal growth, a picture taken, and then the radiographer is going to interpret it. Then you are supposed to also carry out a self-examination of your breast. You should know your cycle. If it's not a regular one, at least some days after your ovulation, you're supposed to check. Okay, examine your breast for lumps. You should look at them, use the mirror, full-length mirror, to look at the shape of your breast. Every day just look at it. Look, what does it look like? Look at the nipples. How are they? The breast itself, what does it look like? Is it dimpled like an orange and all that? Is the nipple inverted? So take time to just look at your breast. Look at your breast from time to time. Maintain a healthy weight. Okay, obesity is not a good thing for us. So maintain a healthy weight. Limit alcohol consumption. If you must take, it is said you should take 1 drink a day. 1 drink for some people might be half a teaspoon and they are knocked off. So it depends on 1 drink. The best bet, if you can avoid alcohol, please do so. Stay physically active. Try to exercise as much as possible every day. At least 30 minutes a day wouldn't kill us. Brisk walk, just taking a walk. Some of us, like me, that are living very sedentary lifestyle, we come out, we enter a car to the office, enter a car. In fact, like a friend, Dr. Bona would say, if you could even ask somebody to go to the toilet for yourself, you would go. We are now so lazy. So please, any reason for you to take a walk, please do. Then for those that are giving, have given birth or are giving birth or pregnant and all that, let's try to breastfeed. Okay, so people, oh, I don't want my breast to fall. So because of that, they don't breastfeed their children. So please, let's breastfeed. Like I've said, prevention usually is better than cure. The earlier we can detect and prevent cancer, the better for us. I recall the first time I went to do a mammogram, I thought I felt a lump and I was scared. A friend went with me, and then when I was checked, it was a scan that was just done initially. And then did I do a mammogram that day? Yes, I did a mammogram. And then my friend was now asked to do the scan, and she refused. Meanwhile, she took me there. She was supposed to support me, but she was scared, and that's one thing I have noticed with us Nigerians. We are unnecessarily scared, whereas the earlier we detect, the better for us. But our attitude is that I don't want to know. It's not my portion, God forbid. But when it happens, what happens? So till now, she hasn't done that scanning, let alone a mammogram. Because as far as she's concerned, it's not her portion. And incidentally, that particular day, I had no issues with my breast. It was the subsequent test, follow-up, that we now had issues. So please, let us not be scared of doing tests, carrying out tests, because the earlier you know, the better for us. I know that after I had come down, been diagnosed with cancer, and I talk about it, a lot of people, my friends, are like, oh, why do you let people know what's wrong with you? And I'm like, excuse me. And I know that with that, talking about it, I have been able to, will I even say save? I didn't really save them because it was already far gone. You know, the people that got to talk with me had let it go too far. One of my colleagues, his wife, was scared. What will happen? How can she go? Her mother was, supporting her that if she goes go to remove the breast, the husband will marry somebody else, and she forgets that her culture allows the man to marry up to four. Her religion allows the man to marry up to four. So she didn't go for it. So by the time the man got talking to me and he was down begging me that please, he would like me to speak with the man. I said, please, anytime. So I think he on his own spoke with her that, oh, his colleague has gone through this. There is no fear. You know, they had to meet me to recommend them to a doctor in Abuja. By the time they went there, of course, it was not. When he sent me his result as if I was a doctor. I didn't bother looking at it, but just a cursory look, I knew it was already a bad case. And of course, it didn't take up to a month, and she was gone. You know, the fear she had, oh, dying and leaving her children and the husband to take somebody, it still has happened. You know, so the earlier we take, do the tests, and know our status, the better for us. The easier it will be to manage. We have a doctor who would speak and would be able to know everything about cancer, the symptoms, and all that. So let me not talk too much. So get screened regularly, vaccinate if you are in the age group, if you are qualified to, against HPV, and adopt a healthy lifestyle. Of course, together we can. Thank you very much.
Thank you so much, Ma. Thank you for this very insightful session. Thank you so much. I hope we have learned a lot from this speech. And please, if you have questions for our keynote speaker, please just start writing them somewhere, or you can drop them in the chat box already, so that when it's time for our question and answer sessions, it can be answered. So please just start gathering your questions. I'm sure we have questions already because this was a very informative session. Thank you so much, Ma, once again. So next, we'll be moving to the ice break session, and to be taken by the person of our former Vice President of the SPE Fufu chapter, Ms. Temitope Asimi. So over to you, Ms. Temitope. Hello, Ms. Temi, can you hear me?
Okay, good evening. Can you hear me?
We can hear you, Ma. Good evening.
Okay, good evening, everyone. So welcome to the icebreaker session. So we're just doing this on a lighter note, and it's going to be basically a true and false question. So you can just drop your answer on the chat box. We're going to be checking out and looking for the first person to drop their answers on the group. It's just for fun. So the first question, and it's displayed on the screen, so you can just read with me and drop your answers on the chat box. So is it true that I'm going to be starting with question one. Is it true that wearing deodorant puts me at the higher risk of breast cancer? True or false? So I'll be going through the chat box to check for your answers. Thank you. So that's correct. I can see Crystal dropping false. So that's very true. Using deodorant does not put you at risk of breast cancer. It is not scientifically proven yet. So the second question, and thank you. I also saw Evie. Thank you very much. So the second question is, dash cancer is a type of cancer that occurs in the cervix, which is the lower part of the uterus in the female reproductive system. So which of the cancers? So we are basically talking about two types of cancers in this program, cervical or the breast cancer. Thank you, cervical cancer. So we have Princess again and Bingla. Thank you. Okay, on to the third question. I hope thank you, Mrs. Pamela. Thank you. So to the third question, only some women are at the risk of getting breast cancer, like those with a family history of breast cancer. Is this true or false? Is it true that it's only when it's in the family that you can get breast cancer? Okay, so I can see Bingla saying false, and that is correct. Yeah, cancer is not a historical problem. It can happen to anybody, any age, any sex. So on to the next, number 4. So plastic water bottles cause breast cancer. Is this true or false? Number 4, does plastic water bottle cause breast cancer? Thank you, Princess. So it is false. Water bottles don't cause breast cancer. So onto the fifth question. So is cervical cancer for women with above 40? Yes, only. True or false? Is it only women above 40 that can have cervical cancer? Thank you, Princess. Is the only Princess we have here? Because she's the only one dropping answers very fast. Please let us all try to drop our answers. So we're taking the last one. Thank you very much, Mela. Thank you. It is false. It's not when you're over 40 that you can have cervical cancer. It's for any age, just like other cancers too. So number 6, breast cancer or cervical cancer, which is the most common in women? I want to see our answers. So yeah, thank you. So we're leaving the winner to be Princess. So Princess has been the one dropping both answer. Thank you, Edie. Thank you, Princess. Breast cancer. Yeah, breast cancer is the most common cancer for women, and cervical cancer is the 4th most common cancer for women. So thank you for engaging. Thank you, Ifama. Thank you, everyone, for engaging in the icebreaker session. I hope we enjoyed answering the question. Thank you. Over to you, moderator Michelle.
Thank you so much, Miss Temi, for the icebreaker session. At least we'll be able to answer some few questions and also learn a lot from this. Very quickly, we'll be moving to the next session and we'll be having our doctor. She will be giving us some key insights about cervical cancer and breast cancer. So we'll be having our doctor at this moment. And please, I want the second moderator, Miss Claire, to please quickly read out our profile for us.
Okay, good evening, everyone. Please confirm if you can hear me.
We can hear you.
Okay. Dr. Nyechi Obasi is a medical doctor who graduated from University of Nigeria, Nsukka in 2022. Known for her spirit and commitment to noble causes, Dr. Obasi served as a vice president for the Federal of Catholic Medical and Dental Students. As a student and actively engaged in several volunteer activities throughout her undergraduate years. Besides her academic and career commitments, Dr. Obasi is passionate about dancing, sports, fine arts, and personal development. She is also a devoted wife and a mother to a set of twins. Currently, Dr. Obasi resides with her family in Canada, where she intends to pursue her career in family medicine and contribute to driving the achievement of Sustainable Development Goal 3, Health for All. Thank you. That's all, you can continue.
Okay, thank you so much, Claire. So we'll be welcoming our speaker, Dr. Onyinyechi Obasi, with a round of applause. Please, let's welcome our speaker. I want you to drop your reactions as our speaker gives us these key insights. Please, let's welcome our speaker, Dr. Onyinyechi Obasi. Over to you, Doctor.
Good day, everyone. Thank you so much. I am very honored to be here. First of all, I'd like to thank the foundation for meeting me and, giving me this opportunity to have this talk on our cervical and breast cancer health. And also, I would like to thank the keynote speaker. She really said basically everything. So, and I know that cervical cancer and breast cancer is not something that is new to us. So basically, I think the only thing I can do is just to lay more emphasis and just talk more about the cervical cancer and make sure that everyone leaves here with something, even if it's just one lesson or the other. Even the question session was very interesting. So basically, if you can answer all those questions, I don't think there's anything I need to say to add to that, but it goes by. So basically, I think I would share my screen and share my slides so that we can proceed. Thank you very much. So I don't know if everyone can hear me. Can everyone hear me?
We can hear you, ma. Yes, ma.
Okay, thank you. So thank you for the person that introduced me as well. Like, I'm very grateful. So we're going to begin with the topic for the day, which is the guide to cervical cancer and breast cancer prevention. I'm just going to give a brief talk on basically everything that we must have heard about. And if there's any questions in the end, you can just write it in the comment section. I'm going to talk about majorly the causes, the symptoms, and the prevention of cervical cancer. So it's just going to be a very short interactive session. So this is the agenda: the epidemiology, causes, risk factors, symptoms, treatment, and prevention. So we're going to start with cervical cancer first. So you can look at this. If you look at this slide here, if you look at this slide, you'll see the female reproductive anatomy. So what is cervical cancer? We keep hearing cervical cancer, cervical cancer. What is cervical cancer? Is basically a cancer that begins in the cervix. If you look at this picture here, you would see the cervix, which is just located at the bottom of the uterus. The uterus is also known as the womb. So the cervix is just the lower part of the womb, and it serves as a gatekeeper for a woman when she's pregnant. So what it does is to hold the baby in place so that the baby doesn't slip out. So it holds the babies in place, and it's just located at the bottom of the uterus, and it is a long cylinder tube, like a cylinder. So cervical cancer, like I said, is just cancer of the cervix, and it is the most common gynecological cancer in women globally. So it ranks the third amongst all malignancies in women. So it begins when healthy cells in the cervix develop changes in their DNA. A cell's DNA is something that contains the instruction that tells the cell what to do. So when the cell starts changing, when the DNA tells the cell to change and multiply quickly, these abnormal cells keep multiplying and invading into normal healthy tissues. And when they invade into normal healthy body tissues in the cervix, it can spread to other parts of the body, and you'd get what we call cancer, which is cervical cancer. So basically, abnormal tissues get multiply, and when they multiply, it can lead to cancer in the cervix. So we're going to go to the epidemiology. Epidemiology is basically telling us the number of women globally that presents with this cancer. And in the whole world, we have about 500,000 women that acquire this disease. So that is like saying 75 to 80% are from developing countries like Nigeria. So out of these 500,000 women that come down with cervical cancer, 75 to 80% are from developing countries, and about 300,000 from these 500,000 die every year from cancer. So that's like a very high rate of women that die every year. And in Nigeria, cervical cancer ranks the second leading cause of female cancer. The first in Nigeria is breast cancer, although we know that the cervical cancer is the fourth most common cancer in women, or some people say is the third. But in Nigeria, it is the second leading cause of female cancer, the first being breast cancer. So about over 14,000 new cases are diagnosed every year, and more than half of those new cases die every year. So it's just very, very terrible, with a 5-year survival rate. So it's something that needs more awareness, and we need lots of people to actually know about this cervical cancer, because it's taking lots of our women. So we go over to the causes. The major cause of cervical cancer is HPV. That's the human papilloma virus. Like 95% of cervical cancer is due to the human papilloma virus infection, which is known as HPV. The other ones are just minor viral infections that are just hardly seen or documented, like the cytomegalovirus and the human herpes simplex virus too. So what is this human papilloma virus? Human papilloma virus, HPV, is one of the commonly sexually transmitted infections, and it's a group of viruses. So when you hear of HPV, it's not just one virus. There are so many types, over 150, and it can be transmitted through vaginal, anal, or oral sex with someone that is infected. So the major human papilloma virus, which we normally discuss, is the type 16 and type 18. And these type 16 and 18 are what causes cancer, the cervical cancer that we know of. So when you hear, like, what is the cause of cervical cancer, the major cause of cervical cancer is human papilloma virus type 16 and 18. Then we also have a very common one, which is type 6 and 11, but they are known to cause genital warts. So genital warts is another sexually transmitted infection, and it is caused by this same HPV, but type 6 and 11. So when the vaccines that are used to treat or to prevent cervical cancer it usually targets the HPV 16, 18, 6, and 11. The other types, the other 100 and something types of cervical cancer, some of them they're not carcinogenic, or they may be possibly carcinogenic, and the body just helps to clear them off. So what happens when someone contracts HPV, that's human papilloma virus, we should know that every or almost everyone who has been sexually active has been exposed to human papilloma virus. So there is no stigma or shame in it. It's just like every other existing virus is out there, it's even mostly seen in men and it's transferred from them. So whenever those who are sexually active has been exposed to it in one way or the other. So once a woman contracts this HPV, most of the HPV types would clear on its own over time, because this is because your body, you already have an immunity that fights off viruses like even other cold or flu and the rest of them. So it is normal. It is not something that is like you have to be scared of when you hear of being exposed to HPV. But the only problem is that you don't know which, if you are amongst the women who would not clear this human papilloma virus out of the system, especially if you have contacted the type 16 and 18, which is carcinogenic. So some women don't, some women, for some reasons that we don't understand, will continue to be HPV positive, and slowly these cancer cells will continue to develop and change and lead to the cervical cancer that we know. So we're going to talk about the risk factors, since we know that HPV is actually the cause of cervical cancer. So what causes this HPV, or what can predispose someone to having this human papilloma virus? We've already mentioned being sexually active. So even teenagers, even children are exposed to this HPV, even without being sexually active. Some women have been assaulted, some women have been raped. So this already exposes almost everybody to human papilloma virus that causes cervical cancer. So some of the risk factors that can predispose one to having this HPV include unprotected sex, especially those who use birth control pills. Like when you take all those birth control pills to prevent pregnancy, some women like just have sex without using any barrier method or condoms. So because of this, you expose yourself to STDs, and HPV is one of them, and it's one of the major STDs. So history of or presence of other STDs, especially HIV infection, like someone who is HIV positive has a higher chances of contacting human papilloma virus. Lack of regular cervical screening is one of the is very, you can't even emphasize it, because you never can tell who has cervical cancer because you can't see your cervix. So you don't know. The only way you can find out if someone has cervical cancer is through screening. So if you are not screening regularly, you may be exposed to this virus and you won't know until it progresses to a more a more advanced stage, and it will be very hard to treat there. So high risk sexual behaviors like having sex at a young age, multiple childbirths, having multiple sexual partners, all these are risk factors for contracting HPV. Smoking, low socioeconomic status, immunocompromised state, that's when your immunity is low, like you have HIV or diabetes and you smoke a lot. This is a bad lifestyle. So it would only lead to predisposing you to HPV. Then family history is also a risk factor. We have the bimodal distribution. Cervical cancer is most common in women between 30 to 39 and 60 to 69. So it doesn't mean that other women at a lower age or higher cannot contact it, but it has been seen in in this age group. And then race, being Africans, and the vitamin deficiencies are also risk factors for cervical cancer. So we are going to move over to the symptoms of cervical cancer. Unfortunately, cervical cancer, majority of cervical cancer is asymptomatic. So it makes it very difficult to detect if you are not coming for a routine check. So that's why we have to keep emphasizing and emphasizing on this. You can never tell if you have cervical cancer. The only time you may actually find out that you are having symptoms or it may be cervical cancer, apart from this, your family history, is when you start developing symptoms that are seen in the advanced stage of cervical cancer. And these symptoms include problems with urination, the pain in urination, which is known as dysuria, frequent urination, and you have this fullness or pressure in your pelvis area, which is like the reproductive area. Then we also have vaginal bleeding, like all kinds of vaginal bleeding. When if for those that are still menstruating, when you start having irregular vaginal bleeding in between your menses, when you have bleeding after sexual intercourse, then for those who have gotten to menopause, you notice that you're still having vaginal bleeding even after your menopause. This is a symptom or a sign that you have cervical cancer. Then we also have vaginal discharge. You notice that your discharge is usually watery, or it's bulky, or it's smelling, or it's pussy. So all this discharge that is abnormal, other than the normal vaginal discharge you have on your ovulation day, is just makes you think, oh, you need to go and check with your OBGYN. Then if you're having pain during sex, known as dyspareunia, low back pain or pelvic pain, these are symptoms of cervical cancer. Then also cachexia, you notice that you're slimming down or like unexplained weight loss. These are risk factors. These are symptoms of cervical cancer. So we're going to go back to the treatment and prevention, and we cannot overemphasize that the prevention of cervical cancer and the treatment, it depends on the stage of the cervical cancer. So these are the stages of cervical cancer. So you can see here in stage 1, cancer is found just in the cervix. Then stage 2, the cancer has spread from the cervix to the upper part of the vagina or the tissue around the uterus. For stage 3, the cancer has spread to the lower part of the vagina or to the pelvic wall. It can block the flow of the urine to the bladder. Here you start developing symptoms. So in stage 1, you may not even know that it is there, and in stage 2. But from stage 3, you start developing symptoms. In stage 4, it has even spread to other parts of the body that is outside the pelvis, the lungs, the liver. And at that point, it's just basically palliative treatment therapy. So for the treatment, like we said, it depends on the stage of the disease, and the modalities include surgery, radiotherapy, chemotherapy, targeted therapy, immunotherapy. All these therapies are different ways of treating cervical cancer. But for the pre-cancer stage, the procedure can be done in the office and use laser and conization. Surgery is the main treatment, especially for early stages, and it includes hysterectomy. Hysterectomy is the removal of the uterus, of the womb. Trachelectomy is removal of the cervix. Lymphadenectomy, removal of the lymph nodes that drain the fluids around the cervix and the womb. So basically, surgery is the main treatment for cervical cancer. When you go in for your screening test and they find precancer cells that are unhealthy, that may eventually develop into cervical cancer, into cancerous cells, the option is usually surgery to take out the whole of the uterus or the womb. So this is why you need to always meet your healthcare team or your OBGYN so that you can discuss, especially if you are a young lady who is still who is not married or has not completed her family. So maybe you still want to have more children or something like that. You can always discuss the treatment options with your doctor. So for more advanced stage, we use the combination of radiotherapy and chemotherapy. Radiotherapy is the use of radiation or X-rays that to target the cancer cells and like destroy them and take them out. Then chemotherapy, the use of drugs to either stop or kill the cancer cells. So basically, these are what these treatment options do. So the most important one, like I made mention of, is clinical trials and follow-up care. Like you have to always follow up with your doctor. So for the prevention, we have the primary prevention and the secondary prevention. At this point, I want us to know that cervical cancer is so dangerous because you can't see your cervix and you can't feel your cervix. So you can be developing precancer cells and you would not have any idea at all. And the reasons, there are two major reasons why we can actually get cervical cancer. And the two major reasons is because either we are not vaccinated against this human papilloma virus that causes cervical cancer, or we are not able to get a routine pap smear or HPV test. So as we all know, or if we don't know, I'm telling us now that cervical cancer has actually been cured, and it has actually been cured by the vaccine. This vaccine includes this quadrivalent vaccine, Gardasil. It's called Gardasil. It fights against HPV 6, 11, 16, and 18. So it fights against the human papilloma viruses that is not easily cleared by the body. So the HPV 6 and 11, like I said before, is it causes genital warts. So the Gardasil fights against it, and it also fights against the cervical cancer, the HPV 16 and 18, which causes cervical cancer. Then we also have the bivalent vaccine called Cervarix, which fights against the HPV 16 and 18. So the prevention is all about vaccination. So vaccination is mostly recommended for children, which children between 9 to 13 years, because they've not been exposed, they are not sexually active. So, and it is recommended for everybody, regardless of the sex. So both boys should be vaccinated because they are not only just carriers, but they are also they can also affect their later partners, and also they are at risk of penile cancers because, like I told you, HPV is a lot of viruses. So some of the HPV can cause penile cancer. So it is recommended that the children between 9 to 13 years should get this vaccination. Just imagine if every child in Nigeria gets vaccinated, we won't be bothered about anything that has to do when it comes to cervical cancer, because we've literally fought it, just like other NPI schedule vaccines that are given to children. It will be a very wonderful thing if cervical cancer can be given to every child. But for now, the country is still developing, so we hope that it's going to get better in the future. Then practice safe sex. We can't overemphasize that because it's just very important. It can reduce the risk of cervical cancer by taking measures to prevent STIs, not just HPV alone. You have to use condom if you want to have sex, and you have to limit the number of your sexual partners, especially if you're not married. So if you're not married, please make use of condoms, because it will protect you from a lot of sexually transmitted infection. Then health education is very important. Avoid smoking. Teach your young ones how to practice safe sex, and also how to abstain if possible, how to take care of their reproductive health, how to maintain personal hygiene. It's very, very important. So the secondary prevention involves the screening test, like I said. So pap smear test is the major test that we use for preventing cervical cancer. It detects precancerous conditions of the cervix, and it can detect the HPV types 16 and 18, which can be monitored and treated in order to prevent cervical cancer. So most organizations begin routine pap test at age 21. And the reason is because the body basically fights off infection due to the stronger immunity in the young. So we that are young, or like the young ones that are below 21, they have a strong immunity. So they can basically fight off any infection if they're exposed to it. Especially if they are not sexually active, there's no need to actually do a pap test. The best thing is just to go and vaccinate. So, but when you are like 21 years and above, it is recommended that you do a pap test. So the women between 30 to 64 years should have screening at least once in their lifetime. And then it should be done every 3 to 5 years in order to catch the abnormality on time, because that's just the most important thing. If you don't screen, you cannot know if you have cervical cancer, and you may only find out when it's already too late. The other HPV test or screening tests include colposcopy and cervical biopsy. This is when you go for a screening test and maybe your pap smear test is positive, and then the doctor may send you further for more testing and to see which treatment option is better for you. So this is just a diagram showing us how the pap smear is being conducted. You can see the patient lying in a lithotomy position. The legs are flexed. And then this instrument known as the speculum is passed through to help view the cervix. This is the cervix. Then a brush like this brush is used to scrape the cervix and examine the cells around the cervix to check if there's any precancerous or any abnormal cell at all. So, in summary, HPV is the major cause of cancer of the cervix. Pap smear, amongst other tests and follow-ups, are used for early detection of cervical cancer. The presentation is usually asymptomatic, so the only way to find out is by going for screening tests, and vaccination is used for prevention, among other safe practices. The treatment of the stage of the disease and survival can be high if treated early. So the treatment is depending on the stage of the disease. So there are many techniques that have been used for women with cervical cancer, and it is available. Like if you go to your OBGYN, you would learn more of many options that is better for you to help you retain your fertility, especially if you still want to have more children, or complete your family. And then personal lifestyle modification, avoid smoking, always screen, and always visit your doctor. So it's also important for us to know that Cervical Cancer Awareness Month is in January. So please let us continue to spread the love and spread the information as much as we can to always vaccinate our kids, and also to also screen ourselves. So it's also important to know that October is Breast Cancer Awareness Month. So we are going to move, having said that, we're going to move to breast cancer. Breast cancer is a malignant tumor that begins as a growth of cells in the breast tissues. So a group of cells, or let me say an abnormal cell, can invade into the surrounding tissues and start spreading, that metastasize to other parts of the body. It doesn't just happen in women because everybody is born with some breast tissue. So both men can get breast cancer. And it happens more in the lining of the duct or the lobes. If you look at this picture here, you would see this glands that I'm pointing towards, and this here is called lobes, and there are some lines here that are draining or like going towards the nipple. Those are the ducts. So majorly the breast cancer usually occur in this area and this area, that's the lobes and the ducts. So we have so many types of breast cancers. If you look at the anatomy here, like I mentioned, this is the milk duct and this is the lobus. So majority of or the breast cancer that causes serious issues, like the ones that is malignant, usually occur in the lobus and in the ducts. So we have different types. We have the ductal carcinoma in situ, known as DCIS. It is non-invasive. Like it is the abnormal cells have been found in the lining of the milk ducts. That's this one, ductal carcinoma in situ. Sorry. So the cells have not spread outside of the ducts. They are just inside those ducts. And it is highly treatable because it is not invasive. So if left untreated, it can actually spread to the surrounding tissues. Then we have the invasive ductal carcinoma. The invasive ductal carcinoma is the most common type of breast cancer, and almost 70 to 80% of people that are diagnosed with breast cancer have what we call this invasive ductal carcinoma, because the first one is not invasive. The second one is invasive, meaning that it can enter into so many breast cancer, so many breast tissues, and it can also affect men. So these cancer cells that begin from the abnormal cancer cells, they start forming in the milk duct and it spreads to other parts of the body. Then we have the invasive lobular carcinoma. And this invasive lobular carcinoma can start in cells in the milk glands, which is this lobus here. So these lobus are designed to actually make breast milk. So when the cancer happens in these lobus, it's known as the invasive lobular carcinoma. Metastatic breast cancer is just cancer that spreads to other parts of the breast. So that's just it for the types. The other ones, we have male breast cancer, recurrent breast cancer, angiosarcoma. Angiosarcoma is the cancer that occurs in the lymph nodes, the ones that drain the breast tissues. Lymph nodes are basically like some structures that help to drain fluid, excess fluid from other parts of the body. So the cause of breast cancer is unknown, even though we have found out that there are risk factors that may increase breast cancer. unlike the cervical cancer that is known, which is the HPV, and we have risk factors for HPV. For breast cancer, the cause is actually unknown. So breast cancer starts when something changes in the DNA of the cells of the breast tissue. So this tumor can grow and invade and destroy healthy body tissues. And when it spreads, it's like it becomes metastatic. So there is no reason, or there's no we don't have any reason why some people have breast cancer and some don't have breast cancer. Even those who have the risk factor for breast cancer do not get breast cancer, while those who do not have the risk factor may develop breast cancer. So breast cancer is something that can affect anybody at all. So that is why it's very important, and we always talk about breast cancer and have an awareness month for it, which is October. So the risk factors for having a breast cancer include family history of breast cancer. If your parents, your sibling, your child, or you, like if someone has had breast cancer before, your risk of getting that breast cancer is increased. So the risk of is higher if your family has the history of getting breast cancer at a young age. The risk is also high if you have multiple family members with breast cancer. But it's still important for us to note that most of the women that are diagnosed with breast cancer don't actually have a family history. Like, so you can't really pinpoint anybody and say, oh, because you have family history, you would have it's most likely that you will get breast cancer. The only thing you can do is just to try and prevent it, or like keep going for screening tests like the keynote speaker made mention of. It's very, very important. So personal history of breast cancer. If you are a woman and you've had cancer in one breast, you have the greater chance of having another cancer in that same breast or in another part of your breast or in the other breast. So it is also a risk factor. Personal history of other breast conditions is also a risk factor. Like if you have other types of cancer of the breast or swelling or anything, it is also a risk factor. So that's why when you go to meet your OBGYN, they talk about doing a breast biopsy to see if you have those conditions that can increase your risk of breast cancer. Then we have what we call early menarche or late menopause. When early menarche is basically beginning your period before the age of 12, and then beginning menopause for late menopause, beginning menopause after age 55. So these two have an increased risk of breast cancer. Then the reason actually is because, when you are exposed to the hormones, estrogen and progesterone, they can increase the risk of you having breast cancer, because these cancer cells feed on those hormones, those estrogen and progesterone. So when you have you're starting your menses at age 12, or you are like starting your menopause at a very late age, this can like prolong the estrogen and progesterone in your body and can also increase the risk of having breast cancer. Being female is like being a woman is the main risk factor for breast cancer. While men, they get the disease, but more than like is a ratio of 1 to 100, one man to 100 women. So being a female is a risk factor for breast cancer. Then having dense breast tissue is a risk factor. Alcohol, obesity, drinking alcohol, eating the wrong type of food, these are risk factors. Nulliparity and late parity, that's women who have had no children, they're called nulliparous women. And women who have children at the age of 30 and above 30 have higher risk of having breast cancer. So if you have been pregnant once or more than once, you have a lower chance of getting breast cancer. Age, as you keep getting older, you have a higher risk of getting breast cancer. About 2 of 3 women with invasive breast cancer, they are 55 or older. So genetics too. There is this gene called BRCA1 and BRCA2 gene. Most of the women who have those genes have up to 80% chance of getting this breast cancer. Then some hormone therapy, taking certain hormones, like I told you, those cancer cells feed on estrogen and those hormones, so it can increase your risk of having breast cancer. Birth control pills, same thing, is basically hormones, estrogen and progesterone, so it can increase your risk. Then breastfeeding, if you're not breastfeeding your child, some of the studies have suggested that breastfeeding your baby can reduce your risk of having breast cancer. Then radiation exposure. If you have received radiation treatment, maybe as on your chest when you're a child or something, it can also increase your risk of having breast cancer. So we move on to the symptoms of breast cancer. We have, when you do, some of the symptoms of breast cancer include breast lump. When you notice a thickened part of your breast that feels different from other surrounding tissues. If you notice any changes in your nipple, maybe you have a flat or inverted nipple, it's a symptom of breast cancer. Any change in color or of your breast, in the people that are white skinned, it may look pink or red, while in people with brown or black skin, it may look dark or red or purple. Then changes in the size or the shape of your breast. If you look at yourself in the mirror and you notice your breast is not maybe the way it used to be, it's a funny shape, you have to go and see your doctor. If there is any change in the skin, like you notice any dimpling, or like your breast is looking like an orange peel, like an orange, it's also a symptom, and you need to go see your doctor immediately. Any vaginal discharge, sorry, not vaginal discharge, any nipple discharge, like a clear fluid or bloody fluid from your nipple, is a symptom of breast cancer. Like you'll be suspecting it, so you have to go and see your doctor. Any peeling, scaling, or crusting or flaking of the skin on the breast, like you can see in this picture, any breast pain, any breast dimpling or skin texture changes, lump in the breast or armpits, inverted nipple or nipple discharge, any change in breast shape or size, redness or swelling of the breast, all these are symptoms of early breast cancer, and you just need to go and see your doctor. So these are the stages of breast cancer. You can see stage 0 has 100% survival rates, down to stage 4, which is just 16% survival rates. So it is very important that you always go to your doctor so that the cancer does not progress to stage 4. So for the treatment, we have various treatments, like the cervical cancer, which includes surgery, chemotherapy, radiotherapy, and hormonal therapy. And surgery is the first and most common treatment for breast cancer. It just basically involves removing the tumor. And also, I would like us to know that some breast cancer can either be benign or malignant. So the benign ones are the ones that, like I said, non-invasive, so they don't spread across the other parts of the breast tissue. So those ones are not malignant. They don't cause much problems as long as they are being taken out through surgery. And one of these surgery includes lumpectomy, that's removal of the cancerous tumor without removing the entire breast. Then we have mastectomy. for the ones that are invasive, the ones that have spread, you just have to take out the whole breast, which is called mastectomy, removal of the entire breast. Then we have chemotherapy. It uses drugs, like I said, chemotherapy to either destroy the cancer cells or slow down the growth of the cancer cells. Radiotherapy kills the cancer cells with rays and radiation. Then hormonal therapy, if the cells have hormone receptors, they can prescribe hormone therapy drugs like blockers or inhibitors to destroy the cancer cells. Then we're going to talk about the prevention, the things that you can do to lower the risk of breast cancer. If you find any lump or any change in your breast, you have to first of all make an appointment with your doctor or your healthcare professional. You don't need to wait for the next test, or if you're going for mammogram or anything at all, just report any changes in your breast to your healthcare professional so that if there is any breast cancer, we can detect it early on. So the primary prevention is all about education and lifestyle modification. You have to drink alcohol in moderation if you like alcohol, or better still, don't even take alcohol. And then just limit the amount of alcohol you drink, or do not even take alcohol at all, because it is to prevent breast cancer. It's safer. Then you have to exercise most days of the week. Like the keynote speaker made mention of, exercise, even if it is 30 minutes every day or 4 times in a week. Maintain a healthy diet, maintain a healthy weight, breastfeed as much as you can, limit any hormone therapy for those who has gotten to their menopause. Avoid exposure to any pollution or environmental pollution. You can see in this diagram here, it just says the same thing. Don't smoke, take good care of your health, and so on. So for the secondary screening, it's all about breast cancer screening, and it includes mammography. It is used to detect breast cancer. So we have breast ultrasound, we have magnetic resonance imaging, breast biopsy. Then we have clinical breast exam, which is the one I want to emphasize on, because this one is an examination that is done by a doctor or your nurse. And then we have breast self-examination. So you have to become familiar with your breast through breast self-examination. It cannot prevent breast cancer. There is literally nothing that we can use to prevent breast cancer, but it will help you to understand how your breast looks or feels, so that if there's any abnormality or any changes, any symptoms, you can easily pick it up and then meet your healthcare professional. So sorry. So you have to talk to your doctor. So the tertiary prevention, like we mentioned, use of estrogen blocking medicines, and for preventive surgery, any of the surgeries that I made mention of. So this is a diagram showing how to do a breast self-examination in 6 steps. So the first thing, it should be done a week after your period. Then you look at yourself in the mirror, you stand in front of a mirror that is up to your chest level, and then you lift your hand, you raise your right. If you're checking for your left breast, for instance, you lift your right hand and place it at the back of your head, and then if you're checking for your left breast, for instance, you lift your left hand and place it at the back of your head, and then you use your right hand, your fingertips, to feel and touch every portion of your breast, up, down, left, right, and you feel for any lump or masses. You check your underarm and your armpits and every part of your left breast, and you conduct this while standing up. Then you move over to your right breast, you place your right hand at the back of your neck, and then you use your left hand, the fingertips, to massage and touch all portions of your breast and your armpits. And then you do this while lying down and also while standing up. So if you notice any changes, you consult your doctor so that they can run a clinical examination for you. Then for those who have undergone mastectomy, there is something called breast reconstruction. So the doctors can repair your breast even after a mastectomy. You can see the diagram here. This right breast was completely taken out and they did a reconstruction. Basically, they take a part of some tissues from other parts of your body and attach to the place where the breast has been removed. So it helps to rebuild the breast mound so that it is about the same shape and size as it was before. So in summary, breast cancer is a malignant tumor that starts in the cells, and there are different types. The causes are unknown. However, there are so many risk factors, and the survival rate has been increasing mainly due to widespread support for breast cancer awareness and funding for research. So there are more advances in breast cancer screening now that helps in diagnosing breast cancer early, which increases the chance of a cure. So even when your breast cancer can't be cured, there are many treatments that exist to extend your life. So thank you very much. And I think if there's any questions, now is the best time.
Thank you so much. Thank you so much, Dr. Onyechi. This one was very, very insightful. Please, I want us to appreciate our doctor with our reactions. Please, let's drop our reactions. Let's clap, drop all the reactions we can. This was very, 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 very insightful. I really enjoyed this session, ma. Thank you so much. I'm sure we have questions already. We should have quite a number of questions because personally, I have questions. So I have questions. This one was, you can't just get this anywhere. Thank you so much, ma. I really appreciate. We really appreciate you, ma. So very quickly, we'll be moving to our question and answer session. I think we have questions that we would want to ask our speakers. So I don't know, is Gracefield on the call, please?
Yes, I'm on the call.
All right. So please, you'll be taking our question and answer session. So if you have questions, please drop them in the chat box so that she can read them out for our speakers. So please, let's start dropping our questions. Over to you, Gracefield. Thank you.
Okay, good evening, everyone. I want to thank our doctor for the insightful teaching that she's giving us. And I'm sure we all have questions or we all have learned from what she has said. So right about now, we'll be taking questions. So if you have a question concerning cervical cancer, prevention, the cure, anything that you have, any question you have concerning breast cancer, concerning the lecture that has been given to us, you can state your question. Okay, someone has a question here. It says, so if breast cancer is common in both men and women get to meet their hobby/gene. What about the guy? Okay.
Okay, thank you very much. Okay, thank you very much for the question. It's very simple. Yeah, it can happen in both men and women. So basically, breast cancer, the doctor that you meet, aside your OBGYN, is a general surgeon. So a general surgeon basically treats any is someone who actually treats the does the surgery. So you can, as a guy, you can either meet a general surgeon to do that for you. So it's not a problem at all. Even your OBGYN can also do that as a guy. OBGYN is not just for women alone. It's for both men and women. For instance, if a woman now has a urinary problem, she also gets to meet a urologist. So it's not because urologists are for men most of the time. So that means that the women cannot go to meet a urologist. So you can meet any doctor, a general surgeon or your OBGYN if you have any breast problems. I don't know if I've answered that question. Yeah.
Okay, thank you very much, Mark, for that answer. Okay, we have another question here, which says, from Mitchell, saying, does pap smear test also check for other diseases apart from cervical cancer?
Like I said, what the pap smear does is two things. It tests for precancerous cells and also tests for human papillomavirus. So basically, when you're doing a pap smear test, what it does is just to look for any cell in your cervix that is abnormal. So it would show that, like, that there is a precancerous cell. So it is not just for only the human papillomavirus. Any abnormal cell, that's what the pap smear test does. Then if you don't have any human papillomavirus when you do a pap smear test, then there is no need for you to continue to go for regular pap smear. You just have to go like maybe every 5 years or every 10 years, just something like that. I don't know if I've answered your question.
Okay, ma'am, thank you for that answer. Another question here from Pat Regina. Also, how do you differentiate between the regular kind of lump in the breast and when it becomes cancer? Like, the breast is already made up of some mass, right? So she wants to know, how would you differentiate from the normal mass or lump that is supposed to be in the breast and when it's actually cancer related now?
Yes, thank you for very much. That's a very good question. So, like I said, breasts, when you want to examine your breasts and you look in front of the mirror and you place, for instance, you want to examine your left breast and you place your hand behind your neck, it helps to gives the breast a perfect structure for you to feel the difference between the tissues that are inside of your breast. So if there is a lump in your breast, for instance, or in a female's breast, that you feel a hard mass. It's like you feel a hard mass that is attached to your skin, or it may not even be attached to your skin. It's just to feel different from the rest of your other breast tissues, because your breast tissues, like the image I showed initially, the tissues are clustered together inside of the breast, and then the fatty tissues are just around. So if you have a lump in your breast, you would feel a very hard mass, like it is very distant, so you would know. So I don't I like that is how you differentiate like a lump from the normal tissues in your breast. And then you can't know if it is malignant, like a cancerous like cell that can spread to other part of the body, until you go to your doctor and then conduct some tests. So I don't know if I've answered your question, but if I've not, just like let me know.
Okay, thank you, Ma. Please, if you've asked a question and you're still not satisfied with the answer given, you can clearly state that in the chat box, in the chat section. Okay, Ma, we have another question from Christopher.
I felt bad hearing about breast cancer because I lost my immediate kid sister through breast cancer. I'm so sorry about that. But his question is, can't breast cancer be prevented, or are there no vaccines to be given to female children at their teenage stage to prevent breast cancer in future? Ma'am, over to you.
Okay. Thank you very much for your question. I'm so sorry for your loss. Breast cancer cannot be prevented, and there is no vaccine for breast cancer. The only thing we can do is to try as much as we can to detect it on time. So that is why there is always this awareness of breast cancer, and we always say, examine your breasts. If you notice any changes, any abnormality, go to your doctor to complain about it, because the only thing we can do is to curb it, to stop any further spread of that cancer. And that is only done if you notice any changes early on. And if you notice any changes, if you should go to your OBGYN or your doctor as early as possible. That is the only way we can stop it. And that is why we have the surgery. So if you have, for instance, if maybe your sister, like let me say somebody has a lump in the breast and the person goes on time to the doctor, they take that lump out of the breast because it is abnormal. So once it is taken out of the breast, the next thing, you are free from that cancer at that point, even though you may still have a higher risk of having another cancer cell. But the only thing you can do is just to keep self-examining your breast.
Okay, ma, thank you for that answer. We have another question here from Jay saying, is it normal for one to feel pain from the lump in the breast? Over to you.
Yeah, thank you so much. There are some types of breast cancers that some of them are actually cause breast pain, some don't. But most malignant cancers do not cause breast pain. But if you have any pain in your breast, still go to see your doctor. Different people have different symptoms. So basically, it is a symptom of breast cancer. So it is, I will not say it is normal, but it can be a symptom, because some breast cancers can present painless as well as painful. It may just be something else. It may not be breast cancer. It may just be a cyst or something else that you are feeling in your breast. So by the time you go to meet your doctor and you do an ultrasound or a mammogram, it can help them to know what exactly is happening in your breast. So the only thing that I will advise us is that we should always self-examine our breast and always work on our lifestyle, avoid smoking, eat healthy diets, and exercise as much as possible. Those are the things that we can do, because nobody is exempted, not even me. Like anybody can get breast cancer.
Okay, ma, thank you for that answer. Please, if you sent in a question earlier, please, and your question has not been addressed, please do well to send your question again. I had a little network interruption and I can't see some of the questions that were sent before now. But before that, I have a question, ma'am. So for someone that has been introduced to sex before, is it possible to also get the vaccine, or is for only those that have not been introduced to sex before?
Okay, thank you very much. Yes, like I mentioned, vaccination is something that is very beneficial to those between 9 to 13 years, those who have not been exposed to the virus, because it's assumed that kids of that age don't have any, have not been sexually exposed. But those who have been exposed and and are below 21 or even up to 45 can still get vaccinated if you want to, because when you go for your pap smear and you see that you are clean, there is no HPV, and you want to take the vaccination, you can be vaccinated against the human papilloma virus, because the major thing that the vaccines do, the major HPV that they attack is the type 16, type 18, which causes the cancer, type 6 and 11, which causes genital warts. So basically, if you get vaccinated for it, there's no problem. More studies have shown that it is okay to get vaccinated even up to 45 years.
Okay, thank you very much, Mark, for that answer. We have another question here. It says, from Opafo Victory, I have undergone 2 surgical operations on my left breast, and now sometimes I feel pain in my breast, not quite often though. What should I do, ma'am?
What you should do there is to go back to your doctor. You need to go back to your doctor and explain every single thing that you are feeling, because for you to have done 2 surgical operations, I don't know what the operation is, if it is a lumpectomy, but you need to go back and weigh more options and discuss more options with your doctor, because like the keynote speaker spoke about, that her friend, it is something that is very, very important. You need to prioritize your health first. If it is something that can even lead to complete removal of that entire breast and you are cool with it, it is best for you. If you feel it is best for you, then you can discuss it with your doctor and get it done. Remember, there is always breast reconstruction, so it is not like you're going to be like one-eyed person or something. So if you feel any pain in your breast that is something you don't feel naturally, I think you should still go back again and weigh more options and do a mammogram, depending on what your doctor tells you. Thank you.
Sorry,
Okay,
Doc, if I may come in there. I don't know, Victory, what your surgery was all about, like the doctor had said, because if you had a surgery on the breast, it's expected that it was incised and some tissue was taken out. Was it tested? Or you just taken out and then you went about your business and all that? Because from experience, what I have seen is that if the doctor we meet, the first person we meet is a surgeon. What they want to do immediately is just take it out.
Yes.
That's what the first thing that comes to mind, take it out. So if he took it out, he should have done a test. But if he didn't and you have done it twice, I'd advise that you go get a second opinion and then look at it properly, so that if you need to see an oncologist, please you do so immediately. Thank you.
Yeah, thank you.
Thank you, ma. Thank you, ma. Great speed, please. We have another question here. Please, can you just read out the question? I think it's the last one. Okay, because of time. And please, Dr. Unye, there's another question here. I'll read it out. Pat, Regina is asking, how long can someone with breast cancer last before it becomes deadly, assuming it started at age 18?
But let me come here and laugh small first.
Oh my God.
Please go ahead, doctor.
No, please, you can answer.
No, I can't answer. Go ahead.
Okay, I don't know if you saw my my slide on the stages of cervical cancer and the survival rates. Everything, it's all about your health. You can't be thinking that, oh, you're still 18. Anybody can die from breast cancer as long as it is the malignant cancer, as long as if it spreads across all your breast tissues and enter into other parts of your organs, one can die from it. It doesn't matter the age. So there is no time frame. There's no time frame. Once you notice you have any lump in your breast or any symptoms of breast cancer, you go immediately to your doctor so that they can get it all sorted out, because anybody can die from breast cancer. And the survival rate of someone who has stage 4 breast cancer is 16%. And like, it's some people survive just 5 years, that's at most. And it's very terrible, because that 5 years you're not even enjoying your time. You're just going through lots of chemotherapy, you're taking lots of drugs to kill the cells. And this treatments for the end stage cervical sorry for the end stage breast cancer, they don't just fight against the abnormal cells, they destroy the abnormal cells as well as your normal healthy cells. So you just keep dying and dying every day until you actually give up. So there is no time. There is no time at all. You just have to go to meet your doctor to treat any symptom or problem you have when it comes to breast cancer. I don't know if I've answered that question, or if the keynote speaker has anything to add to it. So
The only thing I can add, please, Pat Regina, if you know anybody that has any tumor or anything, like we said, like I said earlier, the doctor re-emphasized, the key to cancer treatment is taking a test, doing the test, knowing your status early enough, and then starting treatment immediately. It does not matter how old you are. It doesn't matter how early you saw it. Okay, how early, how old you were when you saw it. So what matters is how early, at what stage did you diagnose it? Because the earlier you detect, the more likelihood of your survival rate. Okay. And then the later, of course, the worse it is. But some people have had third stage and then come out of it. So it depends. So let's not do trial and error, because another thing I have noticed in the course of this journey is you start, it's been diagnosed, and rather than go to see an oncologist and start treatment immediately, we run from one church to the other. We take different types of herbs, and then by the time we'll go to hospital, it's rather too late. Okay. Some other people go to hospital, they're on medication, they're on chemo drugs, and they're also taking some herbal infusions, which might be counteractive to the drugs, the chemo drugs they are taking. So I don't know. I think we as Nigerians and as Africans, we should leave this habit of God gave us doctors to be intelligent enough to know and investigate and treat us, take care of us. So let's try to believe them while we are doing our prayers. Yes. Okay. Thank you. Please let me use this opportunity to appreciate Dr. Oduakidoho, Princess Idoho, who has been on this call since when we started. I think she must have seen the flyer. I posted it. I got the flyer late this evening and posted it. So I think she must have seen it and joined us all the way from Port Harcourt. I really do appreciate you joining this call. Thank you very much, ma'am.
Okay, thank you, Ma. Thank you, our keynote speaker and our doctor. So we just have one last question here. So please, do we have a cancer foundation in Nigeria? It's from Christopher. I said he would like to be part of it. And then last question here, from Victory again of Fafo. She's saying, Ma, since I have undergone it twice, how can I do self-examination? Because going to the hospital is a bit expensive, ma. The place was stitched, So ma, I think you will just answer both questions so that we can end the question and answer session.
Okay, thank you very much. So for the first person who asked if there is any cancer foundation in Nigeria, I actually do not know about that. I just know that there are lots of NGOs like that run a lot of things. So you may have to find that out yourself. Or maybe you can meet an OBGYN or any doctor that you know about that. But I don't know if there is any cancer foundation that is run. But I know that lots of NGOs do things like that. And then October is the cervical cancer awareness month. So lots of foundations actually discuss on cervical cancer and breast cancer and how to prevent it. Sorry, I mean October is for breast cancer. Cervical cancer is for January. So lots of NGOs discuss about it, like this one that we are in now. So yeah, that's for that. Then for Victory, what I think, I don't know how recent your last surgery was, but if it is very recent, it may just be pain from the whole surgery, and maybe the medications, the pain medications being given to you is not effective enough, so you have to like meet your doctor to either increase the dose or do something about the pain. But I will not, I can't overemphasize that going to the hospital to meet that doctor is very important. It doesn't matter the expenses, even though I know the economy is very bad, but your if you feel worried about this, I think you should go back to the hospital. You can't do a self-examination on that breast if you just finished a fresh surgery and you're still having pain until like that place has healed. So I am assuming that you just had the second surgery. So if you're still having pain there, is most likely due to the surgery and all the instruments that went through your breast. So that's what is probably causing you the pain at the moment, and you just need to take stronger pain medications for it, which should be prescribed by your doctor.
Okay, thank you very much, Ma, for your answer. And with this, we have come to the end of our question and answer session. Over to you, moderator.
Thank you so much, Gracefield. I want to appreciate our keynote speaker and our doctor once again. I mean, this session was, in fact, very interesting and very, very educative. Thank you so much, doctor. Thank you so much, Mrs. Nfon.
Thank you.
I learned a lot. Like right now, I feel like after this call, I'm going to go and do a self-examination, and I feel like running screening. In fact, it's really interesting and very, very informative. Thank you, Ma. So with this, we have come to the end of this session. We have come to the end of this virtual event, and we'll be taking our closing speech, our closing remark, to be taken by the person of Pamela Oare she will be taking the closing remark very quickly.
All
Over
right,
to
thank
you, Miss
you. Thank
Pamela.
you very much. Thank you. Once again, good evening, everyone. This event has been really, really, really insightful, right? I love how it was delivered. Like, I usually get lost during sessions like this, really, right? But today, I appreciate how it was delivered with terms, like layman terms that all of us can actually relate to it and understand. And I want to sincerely appreciate our keynote speaker, Mrs. Ufong Douglas. Thank you so much, Ma, for sharing your story with us. And true, a lot of us will say that, God forbid, it can't be my portion and all of that. But hearing your story, really, I think you've given us the courage to really go out there, go to the hospital, do that test, do the self-examination ourselves, and like speak about it freely without having any form of bias and all of that. And to our keynote guest speaker, Dr. Onyechi, thank you so much. I really enjoyed your session. I really understood everything that you were saying. Thank you. And I'm sure it's the same for everyone that listening in. Your insight have empowered us and all of us to take like proactive steps in like safeguarding our health and the health of those that we love. And to our moderators, thank you so much for seamlessly guiding us through this session. And to everyone who joined us today, your presence and participation demonstrate that your commitment to health awareness and personal growth. And again, at this point, I would like to highlight the role of Nigerian Girl in STEM, and it's an incredible organization that I'm proud to be part of. NGIS is we're dedicated to empowering girls and our male allies, yes, young women across Nigeria and Africa by providing education, mentorship, and opportunities in STEM fields. So through initiatives like this, the NGIS not only promotes career growth, but also holistic well-being, recognizing that health is key factor in achieving our dreams. I'll always say that everybody has a big dream, but before we say hello to our dreams, we need to be in a good health. So if you like to know more about our programs, our outreach, that's the Nigerian Girl in STEM, and ways to get involved, I encourage you to visit our website, that's nigeriangirlinstem.com. And you can also follow us on all social media handle, that's Nigerian Girl in STEM. Together, we can actually continue to inspire and empower the next generation. So as we leave today, I urge everyone to take the knowledge that we've gained today. Don't throw it out. Take this knowledge here and share with others. Educate, keep spreading the awareness of all of this thing. Remember that early detection is best for all of us. So let's advocate for early detection and prevention in our communities. Thank you once again. Thank you, everyone, and have a good evening.
Okay. Thank you so much, Ma. Thank you so much, Ma. So I don't know if we can have a photograph session quickly. Is that possible?
And I want to thank everybody that
please.
also want to
Turn
thank
camera.
our section chairperson, Dr. Ejiogo. He has been with us on this call till now. So we recognize your presence. Thank you for joining us. I want to also thank Dr. Chris, Mrs. Princess. Thank you all for joining. Thank you, members of the Nigerian Girl in STEM. Thank you, members of SPE. Thank you, everyone. Please do have a good night. Thank you, our moderators. You guys were very wonderful this night.
Ma, please, everyone, turn on your cameras so we can take the photograph. Thank you. Okay, that's fine. Thank you so much.
I realized how time I mean, first it was the meeting on the action of work. Brian had asked Louise to set an appointment with Kai Kwan for 2 o'clock. Louise reported that the class couldn't make the meeting. until 3:30. But when I asked David about it, he said that there had been now that indicated Louise had an agenda for a place that she